Good morning, Erica Vetrini here. Did you know that according to Good Housekeeping, women wait more than 6.5 years on average before they talk to their doctors about unexpected bladder leaks? On today's show, we're talking urinary incontinence with Dr. Conlen, OBGYN, a new imaging device helping doctors diagnose and possibly prevent chronic wounds, and a prescription assistance program that's promising to keep things simple. Access Health starts now. Bladder leakage. Yep, you heard me correctly. Something most of us prefer not to discuss in public, but likely have experienced in one way or another. In fact, over 25 million people in the United States are dealing with urinary incontinence. It affects twice as many women than men, and more than half of those with symptoms have not spoken to their doctors, mostly due to embarrassment. It's time to have some candid girl talk this morning, and who better to have girl talk with than Dr. Conlen, OBGYN. Welcome back, Dr. Conlen.
Good morning, Erica, and thank you for inviting me for some girl talk.
You're the best guy to speak to. It's true, this is an embarrassing subject, but I think if we're honest and we're frank and we have some fun with it, we'll answer some really good questions.
Absolutely. It's a concern for women. It can affect many people. It inhibits their lifestyle. It can be devastating.
When so many people think of leaking bladders and overactive bladders, they think it's something that comes with age. Is that true?
Yes and no.
Okay.
It can occur in the younger person in the 20s if there's a medical issue that's going along with it. When we were young, we trained the bladder. So things that can affect the retraining or untraining of the bladder as we get older can occur at any age. Mostly, though, you're not going to see it in the 20s, but you'll see it after childbearing, maybe in the 30s, perimenopausal, postmenopausal, and in the older female.
And so why does it happen? What's the physiology behind it?
We learned how to control our bladder when we were children. All right, and it was all timing, and it's all manifested by the brain and the neurons that are going back and forth. But as time goes on, the environment and our lifestyle stresses us and makes us conform to different timings and different schedules. And then, of course, with pregnancy, that's going to affect some of the anatomy. But basically what happens is that the bladder is trained and retrained as we get older. And for people that are in jobs where they have to stand all day and they can't go to the restroom on a regular basis, their bladders get used to being over-distended. So it's a combination, and there's several different types and methods for dealing with each one.
I think when we hear the word incontinence, it's referred to in many ways. It's a leaky bladder or overactive bladder. Can you tell me a little bit about the differences?
Yes, the bladder is like a balloon with muscles that go all different ways. If there's something that's irritating the bladder, whether it be a medical problem, a neurological problem that can occur, or even from what they're intaking, what they're drinking, coffee, soda, even some medicines that can irritate the lining, it makes the bladder irritable. And then there's urge incontinence. And this is where you know you have to get to the restroom, but you're not going to get there in time. So you may be 3 feet short. And what happens here is that over time, you have trained your bladder not to tell you when it's getting full. It just gets to a certain point, and then you have to go.
And that can be a significant amount of
That
fluid.
could be an emptying.
Oh, wow.
So that can be quite devastating, all right? And that's something that we really see a lot of. Many times, that's what is the initial issue. And then after we speak with the patients ongoing, then we find out there's a stress incontinence component. And what that is that sudden increase in abdominal pressure from either exercising or stepping off a curb or sneezing or even coughing causes you to leak a little bit.
Okay, and so urges really could be a large amount of
Yes.
fluid, where stress is...
Just maybe a little bit, but you know, there's no hard rules on any of this. It depends on the individual.
And equally difficult to deal with in everyday life, obviously.
In today's lifestyle, being very busy and active and out all day, it can cause people not to go out. It can make them homebound.
Yeah. So then the question is, obviously, what can we do to sort of prevent or manage all of these things?
One of the earliest and best things to do is to take a look and see your lifestyle. So if you're drinking a lot of coffee, soda and not drinking a lot of water, then those byproducts, the metabolites, are going to sit in the bladder and they may become irritable.
People who are suffering with incontinence think they shouldn't drink that much water. Is that the case?
Well, of course, that's the first thing that they want to do, is they'll stop drinking. And that's the last thing they should do, because as we talked about, it concentrates the urine that's in there. But more importantly, if you hydrate yourself, it's how you hydrate yourself. I tell many of my patients, make sure you take a bottle of water with you and work on it all day long. And the other thing that's very important, and this is just the first initial step, is I explain to them they should be voiding by the clock. So for urge incontinence, because they're in the habit of waiting too long, I tell them that they should try and urinate every 90 minutes. It's a good spot to start retraining the bladder so that it's telling you when it's getting a little full. And it is very successful as long as there's no underlying pathology. So it's always make sure that you see a physician and get checked and make sure there's nothing going on that's serious. And the other thing is to manage the leakage with over-the-counter products such as we have here.
So doctor, I walk into the store and there are so many options. It can be incredibly confusing. How do I know what I need?
You're right, there is a lot of variety. But let's take a look at the Tena Intimates.
Okay.
This company has been doing this for 60 years, so it's a great place to start. They're an excellent example of what you should be looking for. It's important that you go ahead and you get a product that has certain criteria with it. So it's very important to take a look and see how the pad functions. One of the most important things is going to be moisture wicking.
Okay.
You want the moisture to be drawn away from the body so that it does not irritate the skin. And also, you want to have odor protection. That's very important. So by taking care of the odor, the wicking, as well as no perfumes, you're going to decrease the possibility of irritation to the patient. People are going to change these a couple times during the day, so it's very important. It must be comfortable. They have many different sizes and shapes to accommodate each individual.
It's all about being comfortable and being confident.
Absolutely.
Doctor, thank you so much for joining us for some girl talk. It's always a pleasure to have you here.
Anytime.
If you are having trouble with urinary incontinence, we urge you to talk to your doctor to make sure it's not anything serious. For more information on the tips and a free sample of the products discussed here today, visit tena.us/accesshealth. And as always, you can go to our website at accesshealth.tv. According to the American Diabetes Association, an estimated 1 out of every 3 people with diabetes over the age of 50 also have peripheral arterial disease, or PAD. PAD is most common in the legs and occurs when narrowed arteries reduce blood flow to your limbs. This results in poor circulation and can cause wounds to heal slower. Major advances have been made in the quest to build a better bandage. However, chronic wounds still affect approximately 6.5 million people in the United States, and the cost of care are expected to exceed the $50 billion mark this year. What if there was an imaging device designed for early intervention and predictive healing of chronic wounds? Here with more information is foot and ankle surgeon and podiatrist, Dr. Nouvong of UCLA Medical Group. Welcome, Dr. Nouvong.
Thank you so much for having me, Erica.
I am so happy to have you here. So let's jump right into it. What exactly is a chronic wound?
Sure. A chronic wound is a wound that does not heal by 50% within approximately 4 weeks with standard or good wound care.
And with the conditions that you see, how do they go hand in hand with chronic wounds?
Well, oftentimes my patients have diabetes and they have both peripheral neuropathy, which is the inability to sense pain, and also patients with peripheral arterial disease.
And so how does that affect the chronic wound?
So patients with peripheral neuropathy do not have the ability to sensate pain. So a small blister or a cut or sore in patients without peripheral neuropathy would actually heal because patients would either change their shoes or change the way they walk. But patients with peripheral neuropathy don't change the way they walk, or they don't change their shoes, so they actually worsen the wounds.
I see. And so what about those with PAD?
So PAD can be of 2 different forms: large vessels, where they bring the major blood flow, or small vessel disease, where the small vessels actually feed the cells that actually heal the wounds.
So then they're not getting the blood flow to the wound, is that it?
Well, there's 2 different problems. Either they're not getting enough blood flow to the wound, or once the blood flow gets to the wound in the small vessels, they may not be utilizing the blood appropriately. So basically, when blood flows through a tissue, you have oxygenated blood or oxyhemoglobin.
Okay.
If the tissue actually uses the oxygen for healing, it converts that into a deoxyhemoglobin.
So it's important to know what's happening at the site of the wound.
Absolutely. So it's important to know that there's blood flow that's converting the oxygen or utilizing it to metabolize, and then also be able to convert that into the deoxyhemoglobin.
Very interesting. So doctor, I hear you have some exciting news. You have a newly available imaging device right here to show us.
Yeah, the technology's been around since 2006, but the new system, the HyperView, is newly developed. This camera here can actually image a patient and look at the oxyhemoglobin and deoxyhemoglobin in patients' tissues.
So doctor, I understand that you currently are using this technology. Can you explain how to use it and how it's benefiting your patients?
Absolutely. So I use it three main ways. One, I will determine whether a wound is going to heal or not based on the results I get from the camera. Number two, I can also predict whether a wound is going to develop or not. If I know something is going to develop, I will take preventive care. Additionally, the system will actually give me information about whether a wound has adequate perfusion or adequate circulation. For example, Erica, in this image here, the area that's red shows adequate blood flow, but the area that's blue here, which correlates with lower oxyhemoglobin and can correlate with poor wound healing. If this was a wound, this area here may not heal at all because it does not have appropriate blood flow. And if my patient does not have enough circulation or inadequate perfusion, I would be able to refer that patient to a vascular specialist earlier.
Access Health caught up with Dr. Bowers-Sumpio, professor at Yale University School of Medicine, in the sections of vascular surgery, interventional radiology, and cardiology to explain how he uses this technology.
As a vascular surgeon, it is important for me to be able to assess the amount of blood flow to the legs or to the foot. The current technologies that we have only assess the large vessels that go to the leg. We may have a good result in terms of our bypass surgeries that we do, and we may also have a good result if we do a balloon angioplasty or a stent into that leg. But we really have no way of knowing for sure that blood flow to that foot is adequate. The HyperView device has special advantage because of its portability, size, ease of use, and the ability to acquire data quickly. So in the operating room or in the cardiac suites, it's easy to use the device on the foot, confirm the segments of the foot that is lacking in perfusion, especially around the area of any ulceration. This way, immediately after the procedure has been done, while the patient is still on the table, we can repeat that assessment, and we can now determine whether or not the intervention that we did, either surgical or endovascular, has succeeded in restoring perfusion to that foot.
That is such great information. It sounds like this could be a real life changer for so many people. Doctor, in your opinion, what are some of the advantages of this technology?
Well, the system is basically like a camera, and it does not touch the patient. So patients with wounds, I'll actually reduce the risk of infection because it does not touch the patient at all. Number two, I get immediate results, and I can discuss that with my patient. So if I can tell my patient whether their wound is going to heal or not, whether they need to go to advanced wound care, and also whether I need to send them to a vascular specialist. Additionally, it provides me clinical images that I can look at with my patient and discuss.
Doctor, thank you so much. This was truly educational today, and I think a lot of people are going to benefit from the information we shared. Where else can they go to get additional resources on this technology?
They can actually go to hypermed.com or ask their doctor if this is an appropriate test for them to have.
Wonderful. If you or someone you love is having a challenging time with wound care, diabetes, or PAD, you can find everything discussed here today on our website, accesshealth.tv, and don't forget to follow us on Facebook and Twitter. See you next time. It's all too common a scenario these days. Millions of Americans are needing to weigh the decision to pay their rent or buy food rather than get their much-needed prescriptions filled. Prescription assistance programs have been part of the healthcare system for many years, providing millions of qualifying patients with prescription medication for low or no cost. While these programs are an important safety net, they can be constantly changing, time-consuming, overwhelming, and confusing. But fortunately, joining us today to offer a helping hand is Maya Loveland from the Simplefill Prescription Assistance Program. Welcome, Maya.
Thank you for having me.
We need you here. There's a lot of information out there. Let's start with the very basics. Help us understand what is the Prescription Assistance Program, otherwise known as PAP, and who is eligible?
Prescription assistance programs are programs that are offered by pharmaceutical companies to provide free or low-cost prescription drugs to qualifying individuals. Each pharmaceutical company is a little bit different, but generally they're designed to help patients who have limited to no prescription coverage and have displayed a financial hardship. These programs started out helping a lot more patients who had no insurance at all, but these days we're seeing a lot more patients coming to us who actually do have insurance, but they now have a very unaffordable copay, or their medication is not covered in their plan anymore. Oftentimes we also see a lot of Medicare patients coming to us who have hit their coverage gap.
So how exactly does the Prescription Assistance Program work?
Each pharmaceutical company is a little bit different. Each one has a different application and a different eligibility guidelines. But all of them do require that the patient and the medical provider submit a portion of the application. The patient is also responsible for including documentation that shows that they're eligible for assistance. And this documentation includes tax returns, copay receipts, insurance cards. It's all a little bit different depending on the patient situation, the patient's medication, and the pharmaceutical company that they're working with. Once all of that information is gathered and submitted to the pharmaceutical company, their application is then reviewed, and if approved, then they're enrolled into the program for up to 1 year before they have to go and re-enroll once again.
So if you are a patient who needs multiple medications, you are doing this process for each pharmaceutical company that you're dealing with, and then you're doing it again every year?
Yes. And you're doing your refills a little bit differently throughout the year as well. And sometimes you can get enrolled into a program and your end enrollment date is one date and then your other one is this. So there's a lot of moving pieces that you have to be paying attention to make sure that your treatment continues.
Which is even more pressure if you are suffering from an illness of some sort, or if you're older and just not able to manage this sort of stuff.
Absolutely. It is a lot to handle, and it can be completely overwhelming for a lot of patients.
So how does someone find out if there's a program out there for them?
The easiest thing to do is call Simplefill. We keep up to date on all programs that are out there and what their eligibility guidelines are. Another option is if the patient knows who makes their medication, they can do a quick search online. The pharmaceutical companies have information about their patient assistance programs right on their website as well.
What if I'm a patient and I decide to hand over the whole process to Simplefill?
At Simplefill, we want to simplify the entire process for the patient and take the burden off the patient. What we do is we always start where the patient can just pick up the phone, give us a call, and talk to what we call a pre-qualifier, who will learn a little bit about the patient's situation, learn about their medications, and tell them right over the phone if they believe they're going to be eligible for assistance. The only thing the patient needs to do is sign the application that we sent out and submit this documentation that we need for them to show that they're eligible. We take care of the entire process from there. Once the patient is enrolled into the program, they're assigned their own advocate. Then we manage the entire refill and re-enrollment when their enrollment expires. We handle all of that.
So Maya, how can someone find out more information about Simplefill and whether they're eligible?
They can go online to our website, or they can just give us a call, and we can learn a little bit about their situation right over the phone, see if they're eligible, and if so, we'll just start working for them immediately.
Thank you so much, Maya, for being here. Such great information. If you or someone you know is struggling with unaffordable medication, you can visit simplefill.com. And of course, you can find everything we discussed today on our website at accesshealth.tv.